Let's talk about diastasis recti and why ab rehab or physical therapy with diastasis recti can help, but it doesn't really fix the underlying problem. Here's your abdomen. Here's your abdominal muscles cross right here. And then this is the separation that you have here. Prior to babies, this is just like a very fine, like a little bitty line right here. And then after babies, this tends to separate or bulge in this area. So you wind up with this diastasis recti. Whenever you have babies, it stretches out and then it tends to come back together. Now, once that coming back together has happened, or once that overstretching out has happened, there's not a whole lot that you can do to undo that after a certain point in time. This is your diastasis that you're left with, 6 months to a year after having a baby. There's nothing that you're going to do as far as strengthening these core muscles that's going to bring this in together, because it's almost like an overly stretched out rubber band. That overly stretched out area can't just fix itself. You're going to have to remove it or plicate it, like bringing it together. Whenever you're doing ab rehab, a lot of times what you're doing is you're strengthening these transversalis muscles or your oblique muscles to help to stabilize this central core area. And what that does is whenever you're engaging those muscles, it keeps everything tight to where this kind of folds down and in. But as soon as you relax that out, you're gonna still have that diastasis. The only way that you can repair diastasis is through a diastasis repair. That's whenever I go in, I find this muscle separation right here, and I bring that together with sutures. So I'm going all the way from top to bottom, bringing all of this together, and then all of these muscles are being relocated to where they are now essentially touching throughout your abdomen. So that's going to be a permanent fix. Ab rehab or physical therapy can help to strengthen those stabilizing core muscles so it can overall help the diastasis, but it's not going to treat the underlying cause. If that physical therapy brings it in enough to where like a 2-3 centimeter diastasis can essentially look and make you feel better, great. We have some patients that have a 10 to 12 centimeter diastasis, and there's no amount of ab rehab that you're going to be able to do to fix that. So whenever I see in the comments people bullying people about you should just do physical therapy, you don't need surgery, you don't know what they're starting off with. Let people get done whatever they want to get